The advantage of a pediatric epileptologist, their pharmacological expertise, and surgical proficiency. That's next on Sutter Doc Talk.
Welcome to Sutter Doc Talk, a Sutter Health Network podcast hosted by physicians for physicians. Each episode features candid conversations with clinical insights and best practices. Now, today's topic.
My name is Dr. Michael Ches. I'm a regional director for pediatric epilepsy and pediatric research in the Sutter-Sacramento region, and I'm a board-certified epilepsy specialist and pediatric neurologist, and a fellow of the American Academy of Neurology and the American Epilepsy Society. I practice with the Sutter Medical Group, having my office in Roseville, California, and I'm also practicing in downtown Sacramento at the Sutter Medical Center Women's and Children's Center. And my clinical and research interests are in the fields of epilepsy, autism, developmental and neuroimmune disorders. Epilepsy can involve all of these and affects 1 in 100 people and can be a lifelong and even life-threatening condition. That is why it is so important to seek expertise and care in the management of epilepsy. Today, we're going to talk about the advantage of seeking pediatric epilepsy specialty care and the advantage of seeking it at a Level 4 center for epilepsy. Epilepsy can affect 1 in 100 people, and in 30 to 40% may become intractable or refractive to simple treatment options. Long-term epilepsy can have an effect in development as well, especially in pediatrics, and children have a bump in a peak in epilepsy onset in the early years and through adolescence and make up a large portion of epileptic patients. Treating epilepsy early may be critical for best outcome. Epilepsy often involves medications, and the International League Against Epilepsy defines refractive epilepsy, making that 30 to 40% of patients we see who are refractive as failing 2 medications. Patients who try 1 medication may respond in 60% of the time, but often if they fail the first medication, they only have a 20 to 30% chance of responding to a second and less than a 15% chance of responding to a third medication. Pediatric epileptologists can be a rare specialty. Specialized training includes general child neurology, as well as extra training in epilepsy and expertise in reading tests such as an EEG or electroencephalogram. Appropriate diagnosis and knowledge of the use of medications and how to diagnose and integrate neuroimaging, electrical activity of the brain, and different genetic aspects of epilepsy are important and require expertise. Knowing how to combine medications and use them to their maximum efficacy is one of the advantages of seeking pediatric epilepsy specialists with pharmacological expertise, and also knowing that there are other options such as non-medical neurostimulatory or neurosurgical options is important for a referring physician to know. Managing and controlling epilepsy can improve the level of intellect and success of a patient through their lifetime. And patients with complex epilepsy often have multiple medications. Having multiple medications requires expertise of how they act pharmacologically so that we can specifically put medicines together that complement each other or act in a synergistic way versus duplicating mechanisms which may not be as effective. And combining this can lead to the maximal control of seizures. Also knowing how to combine medical and non-medical treatments such as diet therapy like the ketogenic diet or other healthcare issues that might be related like managing sleep or other aspects of the neurological condition are important. Being expert in the development of pediatric cases and knowing what developmental milestones should be reached is important to try and keep the child as close as possible to their expected outcomes, hoping for the best developmental and lifelong outcome. When a referring physician makes a referral to a specialist such as myself in a Level 4 center, you're part of a team of experts, and we want to include you in the care of your patients as a team member. We will be communicating with you the things we plan and do for your patients, as well as how to help manage them locally. And we also have a team to help manage, including neuropsychologists, dietitians to help with ketogenic diet and other nutritional issues, social workers to help with issues related to school, environmental, and insurance issues, and also to help support the families. We work in a medical center for women and children with expertise in pediatric intensive care and other subspecialties of pediatric medicine which may overlap our patients with epilepsy and their needs. We happen to have neuroradiologists, pediatric neurosurgeon expertise, We have pediatric specialists in multiple areas that might have involvement to help with the care of patients with epilepsy in other comorbid aspects. And we also have a team of social workers and dietitians to help us with care as well. So one of the advantages is we also do research in a Level 4 center, and we get access to the latest therapies and medications and connect patients to how to find out the most about their condition. Clinical care teams help to coordinate that care with psychological testing available to monitor development and outcomes from surgery or treatments. We have dietary consultation to manage aspects of the diet, and the ability to access opinions from other pediatric specialists where there might be intestinal problems or other health issues. Working in a pediatric health center, such as the Women and Children's Center in Sacramento, allows us to interact with experts in pediatric intensive care and other pediatric subspecialty areas. We have a pediatric neurosurgeon. We work as a team to coordinate the diagnosis and localization of that epilepsy and work before the operation, during the operation, and after the operation as a team to provide the best care. We're blessed to have access to great neuroradiology imaging such as MRI, PET scan, SPECT scan, and access to MEG scan. We also have access to latest technology issues such as software to analyze and integrate the brain EEG localization for surgical access, and also to map out pre-surgically where we need to go. We have robotic surgical help to place multiple electrodes as needed in the intracranial region of the epilepsy. And we also have experts in neurostimulation, including the vagal nerve stimulator, the responsive nerve stimulator called the NeuroPace, and also deep brain stimulation. In summary, the reason to refer to a Level 4 epilepsy center and pediatric epilepsy specialists is to help manage the best developmental outcomes and the best medical management and potential surgical management for patients who need it. We also know that we work as a team with the referring physician, and we want to make sure that the patients and their family get the best support and the child has the best developmental outcome that we can manage. Those are the goals that we have as pediatric epilepsy experts, and we want to hope that we can share those goals with our referring physicians as well as the families of our patients and the patients themselves.
Sutter Doc Talk is a production of the Sutter Health Marketing Department and is affiliated with the Sutter Health Network. Do you want more Doc Talk? Find all of our episodes online at sutterhealth.org/doctalk. That's DOCTALK. Talk to you next time.